Welcome back, viewers. Thank you so much for tuning in. I really appreciate you tuning in to this video. And my name is Patrick Tawaya Matope. On this channel, I do deliver content on social work. And I hope the purpose is that somebody else learns from all this, basically. In today's video, I'm just going to talk to you about the few tips which I'll give, for you to have an effective strategy discussion meetings. This is specifically more to those who chair strategy meetings, and hopefully you're gonna get something. You're gonna grab a few points from this video today. First and foremost, I don't want to consider myself as a guru in social work, but I just do, share nuggets from my own experiences, and hopefully this is supposed to, my hope is that it's going to benefit somebody out there who is possibly stepping up to a management role, and they actually, may benefit from these tips really. So first and foremost, the only thing I will point out straight away is that strategy discussions are critical in children's safeguarding work. They do ensure that our multi-agents professionals make informed decisions in order to protect or safeguard the children that we work with, and from significant harm, obviously. And the first point I just want to talk about today is understanding the purpose of strategy meetings. Why do we have strategy meetings? Because that will help you in order to shape your thinking or your thought processes around how you can actually make sure that this meeting becomes as effective as it can be. As you know, strategy discussions happens whenever there's a reasonable cause to suspect that a child is suffering or is at risk of suffering significant harm according to the Section 47 of the Children's Act of 1999. That's the goal. So the goal is to share, obviously, information, assess risk for that particular child or those children, decide on actions that needs to be done, including whether there's need for us to be initiating what we call a Section 47 inquiry, or to initiate a child protection investigation. That's the Section 47 I'm talking about. The other actions that may also be agreed in a strategy discussion is who does what, when is that action supposed to be done, and whether a child protection medical is required, or an achieving best evidence interview is also required. In regards to that particular referral that you're dealing with. So it's important for you to be understanding the purpose of strategy discussions. That's point number one. Point number two is to also ensure that the right professionals are actually invited to that particular meeting. It's really, really important to make sure that the right professionals are invited to that particular meeting. Why am I saying so? Because for you to be having an effective meeting, you need to make sure that the right professionals are actually invited. If there are concerns around exploitation, you need to make sure that your exploitation coordinator is invited to that meeting, or the exploitation police are also invited to that particular meeting. If, for example, there are concerns around missing, you can't be inviting the wrong people to that kind of platform, because you're not going to get the information you need. If you think that, if it's a missing strategy meeting, then you need to make sure that the missing coordinator is invited. If there are things around prevent or whatever, you need to make sure that your prevent lead is also invited to that particular meeting. I'm just giving examples. So it's important to make sure that the right professionals are also invited. If the child is attending school, or children are attending school, then all the schools those children are attending from that particular family, they need to be invited to that particular meeting. At a minimum, as we know, strategy meeting, there are core professionals that needs to be there. A strategy meeting can't go ahead if the police are not available, and sometimes health professionals are not available. But I've known of strategy meetings which would call strategy discussions, which are held mostly by social care and the police, mostly when health professionals are not available, or maybe it's out of hours. Sometimes a strategy meeting can proceed, but we call them strategy discussions really, where social care and the police have a quick conversation, share information and share intel in terms of assessing risk, and help each other in terms of managing that level of risk. So at minimum, strategy discussion must have children's social care, police, and health. Those three agencies have to be represented. Other agencies, for example, education, prevent lead, missing coordinator, or the exploitation coordinator, exploitation lead, and all other agencies that you can invite. It could be women's aid or whatever. They can be invited to the meeting, but those core three agencies have to be there. You may also need to consider inviting mental health, probation, early help, and any other relevant agents, including the GP. Sometimes can also be invited to strategy meetings. If a child is known to multiple services, ensure that everyone is invited. Everyone from those key agencies is invited. If they can't attend, then they should be able to give a report ahead of the meeting being held, really. Point number 3, as the chair, you need to be prepared and know the case details. Before attending the meeting, you need to review all the relevant case notes, previous referrals, risk assessments on the file, so that you can actually bring accurate information and up-to-date information about the child, about the family, including any previous safeguarding concerns which are there, multi-agents involvement. And if you are coming to the meeting representing an agency, you need to make sure that you have prepared as well for the meeting by gathering all the relevant information that you may need to bring to that particular meeting in advance. If you need to consult any of your colleagues, then please do so that when you come to the meeting, you've got up-to-date and accurate information to share, because at the end of the day, it's supposed to support the discussion around whether threshold is met, threshold of significant harm is met, or what other actions needs to be done out of that particular meeting, really. Point number 4, as the chair, you need to make sure that you keep the child at the center of all the discussions being held. The strategy discussion must focus on the child's lived experiences. This is really, really key and really, really important, rather than on the parental concerns or professional processes. Yes, professional processes can be looked into, parental concerns can be looked into, but we need to focus more on the child. Relevant questions to be asking would be, what is the day like for this particular child? What are their lived experiences? Do they come to school well prepared for the school? Do they come to school presentable? What is their attendance looking like? Any issues around, health, any admissions, all that kind of information needs to be shared within the strategy meeting. We looking into the needs, the worries of the child, strengths of the family, the impact of these risks on the particular child. Remember, impact could be different from a 5-year-old as compared to the 16-year-old within the same family. So you need to be individualizing the child as well in that particular meeting. Point number 5, as the chair, you need to be clear about the risks and the protective factors as well. And as professionals are delivering their reports, you need to be jotting down, the main points, so that you are clear exactly on what on what's going on there. You need to be identifying both current and historical risks. That's why it's always important for you to be looking into the history of those children being known to social care, and the history of those children being known to any of the agencies that are attending. Has there been domestic abuse? Has there been neglect? Has there been substance abuse? Has there been mental health on the part of the parents or on part of one of the children involved? It's important for you to be making sure that all that information is shared. You also need to consider the protective factors, such as the supportive family members who are there, paternal grandmothers, uncles, aunts, and all those other people who are there to support the family. What is it that they can bring on the table? If you will realize that when you attend a strategy meeting, professionals from school may know that family quite well, because they've worked with them maybe for the past 6 years or 7 years when the child has been attending their school. So they may know there's an auntie living so and so, there's an uncle living where, and look also at the engagement of that particular family with the school. Do they have a good relationship with the school? Because that's going to be key in terms of putting your foot in with regards to that particular family. So it's really, really important to make sure that all that information is actually tied through. And look at the community resources which are available as well. What is it that they can tap into? Can we consider a family group conference straight away from that meeting, whether we think that this could be something that can actually support this family? And in so doing, you need to be using your evidence-based risk assessment models to help in terms of decision making. That's really, really important. Point number 6, you need to promote open and constructive information sharing in that particular meeting. And as the chair, it's your role or it's your duty to make sure that you steer conversations towards what you think needs to be happening, rather than focus on the petty issues that could be going between the agencies or among the agencies there. Strategy meetings work best when all agencies share information transparently. So you can actually put a disclaimer from the beginning to say the expectation is that all agencies do share information to the best of their knowledge, so that it can actually help in terms of decision making, risk assessing, and all that. As the chair, it's your role also, it's your duty to make sure that you challenge professional hesitation in sharing due to GDPR or anything else that could be happening. If it's information that you think could help in terms of risk assessing, in terms of decision making, then that information, that particular piece of information may be important. If you're a professional attending, never think that there is information which may not necessarily be important. Experience tells you better. Sometimes you might think this is not important, but sometimes it might be the key to understanding whether this family is going to engage with professionals or not, which could be one of the key decisions that needs to be made out of that particular meeting as well. Remember, the need to safeguard a child overrides issues around data protection and barriers. So if the need is for us to be safeguarding that particular child, you need to be bearing that in mind at the end of the day. You need to ensure that each agency provides a full picture, avoiding assumptions and any gaps that could be there as well. So it's important to make sure that you give the professionals a chance to challenge some of the information that's coming up as well. And point number 7, you need to develop clear and actionable decisions out of that meeting. Who is going to do what? When is it supposed to be done? And what is it that we're going to see to make sure that this action has been taken or this action has been executed to the last? Every strategy meeting should result in a clear plan, which may include whether a Section 47 child protection investigation is required, or whether a joint visit with the police is required, or a medical assessment is required, is what we call CP medicals, or there is need for an immediate safety planning, for even including emergency protection orders. Do we need to be considering that? All that needs to be clear from that particular meeting. And those actions must be specific, must be measurable, must be time bound, should be avoiding vague recommendations. We need to be clear on what it is that we are saying needs to be done out of that particular meeting. Point number 8 is the chair. Remember, it's also your duty to make sure that you record accurately information shared by professionals and in a comprehensive manner. I know there is AI going on in some of the local authorities, but remember, at the end of the day, you need to be accountable for those minutes as well. They need to be humanized. I always tell people that, whenever you do things with AI, at the end of the day, it needs to be humanized. What do I mean by that? Those minutes should clearly document the reason for the meeting, the key risks and protective factors which have been discussed in the meeting, information shared by each particular agent, who has said what, and the implication of whatever has been shared as well, decisions made and the reasons or the rationale behind those decisions being made. If we've agreed that Section 47 inquiry needs to be single agents, what is the rationale? If we've agreed that it needs to be joint, what is the rationale? And what are the next steps that needs to be taken, and who is responsible for those next steps amongst all the professionals? It doesn't necessarily mean that all actions has to be done by the social worker, but some actions can actually be shared. Health can also pick up some actions, police can also pick up some actions, social worker can also pick up some actions, education professionals can also pick up some actions from that particular meeting. And timely and accurate recording is key, because it will help and remind professionals on the actions that they need to be doing, and it can also bring accountability and easy follow through with the actions that you have agreed. Point number 9, while you're in the meeting, you need to make sure that you maintain professional respect, and you also need to challenge professionals where required and as and when required, or as and when needed. Remember, agencies may have different perspective to each and every matter that's being discussed in a meeting. However, it's your duty as a chair and to make sure that you are coordinating the conversations which are going on. If there is a challenge being made by another professional to another, it's for you to be the one to facilitate that conversation happening, challenging constructively when required, but also staying focused on the child's best interest, because that's what you are there to be discussing anyway. If there is any disagreement about thresholds or next steps, you need to make sure that these are clearly recorded, and you need to consider escalating such concerns or such, and also make sure that you are resolving these concerns amicably. And point number 10 is to make sure that there's a follow-up, and you also monitor progress. if you are in the duty and assessment team, make sure that within your 10-day supervision, those actions are actually reviewed in your supervision, and make sure that the social worker is actually actioned some of those actions, or if they're actually on the way of being actioned, you need to have a clear timeline as to what exactly is being done. If there's a need for a follow-up strategy meeting, then one needs to be arranged straight away with agreement of the professionals as well. So strategy meeting is just a start of the process. Ensure that all actions are followed through. You need to, sometimes arrange a review strategy meeting, which I have said already, if concerns persist, and make sure that when you have another review strategy meeting, it's possible that you're actually escalating those concerns to an initial child protection conference or to other steps that needs to be done. And professionals need to be communicating even after the strategy meeting, so that they coordinate the actions that are being done, and we also make sure that everything is being done accordingly. Right. So for you to have effective strategy discussions, it can actually mean that the difference between timely intervention and missed opportunities, it all depends on how the strategy meeting is actually held, information shared, decisions made in that particular meeting, and by ensuring that clear risk assessments are done, strong multi-agents working, decisive actions are actually taken, we are able to actually safeguard the children that we're working with. And I hope with those few nuggets you have managed to gain something from this video. Thank you so much for watching. If you haven't subscribed, please do subscribe. Hit that notification bell so that you're the first to be notified when I post a video. Thank you so much.